Hi, my name is Josh Davis. I'm a second-year resident at Penn State Hershey. So I'm going to talk to you about 10 drugs you need to know that were just approved in the last year. So it was a big year for approving drugs. This is going to be a whirlwind tour. We don't have time to go into all the details of all of the studies for all the drugs. Just want to make you aware of some drugs that you may see, you may be using, or you may see your patients on, and a couple that you just need to know as far as like tox drugs and indications like that. So you're probably thinking, so what? I work in the ED. I ain't got time for that. But there were 59 new drugs approved last year, so it was a big year, 19 first-in-class, and a fair number of biosimilars, which is a new kind of market for FDA-approved drugs that we're going to talk about. So as I said, these are going to be practical things that you're going to be seeing. Some of them are going to be showing up within the year, and some of them were presented this year. Some objectives and disclosures. So the objective is to discuss 10 new drugs approved by the FDA relevant to emergency medicine. I have no disclosures. I'm going to do all on-label uses and the required. If you're giving a pharma lecture, you have to give all the side effects that may be present. So the first drug is going to be baloxavir. So baloxavir is trade name Xofluza. It's the new Tamiflu. For those of you who have not heard of it, it was approved last year to treat influenza A. They did a large multi-center study published in the New England Journal for Xofluza. It works a little bit better than placebo with significantly less side effects than Tamiflu. So this graph here shows that at 3 days, you can see that significantly compared to placebo, it works better. One of the problems with this trial is the way they designed it. So they did a dosing range study with placebo, and then they did like a Tamiflu and placebo-controlled trial. So this was actually out of the dosing trial, and then they focused on the versus Tamiflu results in the other portion of the study. And this is here, you can see it works about the same as Tamiflu. Notable in this slide is that this is viral load. It is not symptoms. And this, again, is versus placebo. It does work better than placebo up to days 3 and 4. So you can see significantly less viral load, not symptoms, which is an important thing to remember. The second drug is cannabidiol, which is Epidiolex is the trade name that the FDA approved. You may have seen lots of CBD-type drugs that were approved. It was approved for juvenile epilepsy. There are lots of CBD products on the market, lots of off-label uses for CBD things, but this is the first one that's been approved by the FDA. You may be aware of some of the side effects that CBD-type products can have. They're significantly less than THC, which is the psychoactive compound in marijuana, the cannabinoid. They're actually the same structure. They just act on different receptors. So somnolence, vomiting, can actually induce seizures, which is kind of weird, but if you've ever listened to a pharma commercial, they all have side effects of the things that they treat and can make you lose an appetite. The next drug that was approved was rifamycin. It's been around for many, many years. It's a rifampin derivative that is used in other countries to treat TB. It was approved by the FDA to treat Montezuma's revenge, which is traveler's diarrhea. So it was done in a large study of people who traveled to Central America. So they either traveled to Mexico or this other lovely country. Does anyone know what country this is? I said Texas, but that's not it. It's Guatemala. So 400 people traveled to either Mexico or Guatemala, and they had significantly reduced incidence of diarrhea. Notably, it was not used to treat blood or fever associated with the diarrhea. Omadacycline, Nuzyra, was approved for community-acquired pneumonia and skin and soft tissue infections. It is an extended spectrum tetracycline, so doxycycline plus some extra coverage for resistant organisms. It probably has a better place for pneumonia than skin and soft tissue infections. Eravacycline was approved for resistant GI infections, so specifically carbapenem-resistant GI infections. So this is a really big gun. Out there, it only comes in an IV form. The benefit of these drugs is their spectrum, so they cover MRSA and VRE and carbapenem resistance, so CRE even for eravacycline. The one thing that they do not cover is Pseudomonas. So if you're concerned for a pseudomonal infection, you're going to have to give additional coverage beyond that. So Plazomicin, Zemdri, was approved for UTIs. This is another one that was also approved for resistant infections and UTIs. So I always have the talk with the older females that come in with frequent UTIs that, eventually that one of them is going to be a resistant one. And this drug was approved, again, for carbapenem-resistant E. coli, Klebsiella, and Proteus. Another drug that was approved outside of the ID range was prucalopride. So I work at an IBS Center of Excellence. I don't know about you guys. So this was a serotonin receptor approved actually for chronic constipation, not technically for IBS, but chronic constipation and chronic pseudo-obstruction reduces the symptoms of constipation and bowel movements every 4 days at least. Lofexidine, Nuzyra. So as we talked about in the last lecture, opioids are a little bit of a problem. I don't know if you've heard about it or not, but we are treating a lot of opioid withdrawal, and medication-assisted treatment is something that's come to the EDs as far as Buprenorphine is what we seem to be using a lot more, or methadone. But one of the things that you run into is they have to actually be in withdrawal to get those treatments, and some people are in minor withdrawal, and some people still have time to go till they get to withdrawal, and this is used to treat the symptoms of withdrawal. So it's very similar to clonidine. It's an alpha-2 blocker. It was studied for opioid withdrawal. It's actually the first one that's approved, the medication that's approved for opioid withdrawal. Clonidine is not actually approved for it and used off-label. However, you could probably argue that they work in the same mechanism. Revafenacin, this is not one that you're going to be prescribing. This is one that you may see your patients on. I seem to see that as soon as a new drug comes out, my patients are on it like the next week for the chronic drugs. Their specialists love it. This one's the COPD drug. It's a LAMA, long-acting muscarinic antagonist, that's used to treat COPD. Similar efficacy to other LAMAs that are out there. And then the last drug, does anyone know this rash? Name that rash. Smallpox. All right, thank you.
So thank you so much. I really like it that you provided so much information in such a short time. I also like it that you included some of the disadvantages and the side effects of the drugs, in addition to what the kind of the drug company party line. So excellent job.